Perfect. All right. Good morning, good afternoon, and good evening. Thank you all so much for joining us today for our first webinar in the Developing Equitable Markets for Menstrual Health Supplies. You can go to the next slide, Madison. In this first webinar, titled Critical Pathways and Collective Action for Menstrual Health Market Development, we will be providing a series overview to the 4 webinars in our Developing Equitable Markets for Menstrual Health Supplies series. This webinar is intended to give you a sense of what's to come with our other webinars within the series, as well as to provide a bit of a teaser for some of the resources, tools, and advocacy messages that will come out of this work. Before we get started on today's content, we wanted to go through a couple of quick logistics. So if we go to the next slide, Madison. The first one is for the meeting translation. We have translation available through Wordly, which is an AI platform that enables translation into over 50 languages. I'm going to drop a link in the chat. And actually, it looks like my link on the screen is not the right one, so don't follow that one, but there's a link in the chat that I just put in there. If you need translation for today's session, you can access translation by clicking on that link. It will then prompt you to enter the language that you would like to follow along in. And you can then use Wordly to either provide captions on your screen as the presentation content is shared, or you can use the device to actually provide audio translation. If you do that, we would just suggest that you mute the audio coming through Zoom. Otherwise, it's a bit difficult to follow both of them. And if you have any issues with Wordly throughout the session today, you are more than welcome to message me, my colleague Andile, or my colleague Madison, and we can help you out with that. A couple of other just quick housekeeping details. One is that for this meeting, we are using Zoom meetings rather than Zoom webinars. And so as we get to the different Q&A sections throughout the webinar, you are more than welcome to come off of mute to ask your question, or you can use the chat to ask your question there. So we're happy to take questions either via writing or live following the different presentations in today's session. Please do feel free to put questions, comments, different conversations in the chat. We want this to be interactive and engaging, so you're more than welcome to do that. And then we will have several different opportunities for Q&A throughout the session. And so we do encourage you, if you have questions, please do ask them. Our speakers will be happy to answer questions and provide additional context where helpful. So we can go to the next slide, Madison. Perfect. So before we jump in and before I hand it over to our menstrual health supplies workstream co-chair, Diana, to provide the opening remarks for the webinar, we wanted to provide some upfront framing about this series and the work that we are launching through this series. So this series really represents the culmination of several different scopes of work that were kicked off last year through the menstrual health supplies workstream, through a couple of specific partnerships with the speakers that you'll see on today's call. And the goal of this series was to address 3 critical pathways to developing healthier, more equitable markets for menstrual health. And those 3 pathways, which you'll hear more about in today's session, include the development of menstrual product standards, the intersection between climate change and menstrual health, and the cost drivers of menstrual health products and opportunities to leverage tax reform to improve affordability. We want to thank all of RHSC's donors for making this work possible, with a special thank you to the UN Sanitation and Hygiene Fund for supporting this work. We also want to recognize the critical importance that menstrual health supplies and access to a high-quality, affordable menstrual health supplies plays within the broader reproductive health landscape and within the work that RHSC does. We view menstrual health not just as a human right, but also as a critical component of reproductive health and broader public health, and recognize the roles that healthy markets play in ensuring that people who menstruate have access to products, not just in the near term, but for years to come. We also wanted to take a moment to emphasize the critical role of collective action in overcoming the many barriers to equitable markets for menstrual health, recognizing that no single actor can solve these barriers alone, and that addressing menstrual health market barriers really relies on the collective efforts of many different partners, many different individuals, and many different people on the ground who are implementing important menstrual health programs. The series that we're kicking off today will be hosted over the course of May and June, it is intended to launch the suite of resources, tools, and advocacy materials that are aimed at creating better access to menstrual health products and developing healthier and more equitable menstrual health markets. In today's session, you'll hear an overview for the series, including some details on what you can expect from these different scopes of work, as well as a sense of what you'll learn in the webinars to come. I also want to include a special thank you to Diana and Tanya, the co-chairs of our menstrual health supplies workstream, for making this work possible, as well as to the many sub-awardees and speakers that we have on today's call for really digging into the details on this work. I will now hand it over to Diana Nelson, who will provide the opening remarks for today's session. Over to you, Diana.
Thanks, Sarah. And I just wanted to give a shout out to Sarah, who has been traveling a lot and is showing up and is so consistent and reliable for our menstrual health work stream. So thank you, Sarah. And thank you everyone for being here today. You know, this project is anchored, as Sarah said, in the menstrual health supplies work stream's work plan, which is a collective blueprint from more than 250 members of our work stream to guide our shared efforts toward more equitable, sustainable access to menstrual products. And each of these areas of work is really about market development and about making sure there's a wide range of high quality menstrual products available and affordable to the people who need them. And each one came, as Sarah mentioned, out of a barrier that we identified within the work stream. And the first one is we'll focus on is product standards. If we want a strong market, we need a range of menstrual products, both single use and multiple use, that people know are safe, reliable, and good quality. So standards serve as a benchmark to make sure products meet essential safety, quality, and performance criteria. Without them, consumers lack protection, manufacturers face uncertainty, and governments struggle to ensure safe and reliable products. So standards also help build market growth by creating guardrails for competition and innovation, while strengthening confidence in new and engaging solutions. And with the development of the ISO TC338, the menstrual product standard, this harmonized standard will also make it easier to import and export products across markets, helping strengthen supply chains so more people can have access to high quality menstrual products. The second relationship between menstrual product supply chain and the climate change is the relationship between these. This is one many people may have not thought about, but it really is a two-way relationship. We need to understand better how the production, transport, and disposal of menstrual products contributes to climate impacts. But we also need to understand how climate change affects access to products through supply chain disruptions, extreme weather, and instability in transportation and markets. There are also real opportunities for us to reduce environmental impacts across menstrual health products and across every stage of the menstrual product life cycle, from raw materials to shipping to use and finally to disposal. If we want menstrual health markets to be sustainable, we need to think about both the environmental impact of products and the way climate change can disrupt access to them. And then finally, we need to better understand what drives product costs and what levers can we pull, not just to make products more affordable, but to do that in a more equitable way. Prices are shaped, as we know, by a lot of different factors, including taxes, levies, fees, supply chain costs, and the list goes on. If we understand those drivers better, we can identify where reform is possible and where policy change could really make a difference. This work includes tools to look at different taxes and fees that are affecting pricing, a way to explore how fiscal policy reform could change affordability, and a set of advocacy recommendations. So I'm excited today that we're going to hear from these amazing different organizations who have done work, and how each of the areas that they focus on, they're going to provide us with some tools and resources that have been produced to help us be more aligned and coordinated so we can have collective action along these critical pathways. Across all of this, we hope to give everyone here and stakeholders better visibility into some of the bottlenecks we've seen, better tools to guide our action, and more so we can have more aligned messaging. At the end of this webinar, we hope you'll be have a better sense of what climate change, tax reform, and quality standards for menstrual products have in common. And we hope you'll be excited for what's on the horizon with the other three webinars, where we'll dig into actions that you can take across all three of these areas. So thank you so much for being here, and we look forward to the exciting discussion we'll have today. Over to you, Sarah.
Thank you so much, Diana. Madison, we can go to the next slide. All right, and so before we jump into the presentations from our speakers today, we just wanted to give everybody a sense of what to expect and to introduce all of our speakers up front. So the first highlight presentation that we will have today will focus on enabling the development and adoption of menstrual product standards in LMICs. This presentation will be done by our colleagues at the Menstrual Health Action for Impact. Today you will hear from Soumya and Tanya. Next slide. The second presentation that you'll hear after the presentation by Soumya and Tanya will be a highlight presentation on the bidirectional impacts of climate change and menstrual health, opportunities for innovation and action. On this presentation, you'll hear from our colleagues from C3, the Climate Communications Collective, including Nicole, Nomi, and Bee. And then next slide. And last, we will hear a highlight presentation on navigating tax reform to improve menstrual product affordability and equitable access, where we will hear from our colleagues at Man Global Health, including Chris and Rita. And so as we dive into these highlight presentations, we will have Q&A time at the end of each of the presentations. So please do feel free to drop questions in the chat as we go, or when we open up the Q&A, if you'd like to come off mute and ask a question, you can just raise your hand to let us know. And then we'll have a little bit of time at the end for some Q&A to bring everything together before we look ahead to the next sessions. And so with that in mind, I will hand it over to Soumya and Tanya for our first presentation. Over to you, Soumya and Tanya.
Thank you, Sarah. Thank you so much. I'm unable to share my...
Now that the slides are down, you should be okay, Tanya, but let me know if that's not working for you.
Yes.
Perfect.
So thank you, everyone. Thank you for joining us today. On behalf of Menstrual Health Action for Impact, or MHAI, we are going to present a brief snapshot of the two resources that we have developed with the RHSC. Both focus on enabling the development and adoption of menstrual product standards in low and middle-income countries, which we will refer to as LMICs. Next slide. So this is the flow of our presentation today. We'll start with some background and project context, and then walk you through a quick overview of the two resources that we have developed. Next slide. According to the LEAP report of 2024 by RHSC, we know that about 1.32 billion people who menstruate live in LMICs. And this number is projected to rise to 1.89 billion by 2035. Despite this, a large proportion of this population still lacks access to purpose-made products. This highlights a clear and urgent need for quality menstrual products in LMIC. And as Diana also highlighted, most of the countries either have no standards or highly variable standards, and thus highlighting the need for standards across LMICs. Next slide. So in 2021, the International Organization for Standardization established the Technical Committee 338 to develop global standards for menstrual products. And more importantly, to ensure that these standards reflect diverse contexts and the diverse realities of the growing LMIC markets, all in terms of the number of consumers, manufacturers, and the volume of trade that happens in these countries. ISO has prioritized encouraging LMIC participation. You would see in the image here that about half of the committee's membership currently comes from LMICs. Next slide. So to further this objective, MHAI has developed resources to encourage participation of national standards bodies, consumer interest groups, and all other menstrual health advocates for their participation in ISO TC 338 processes, and also to encourage them to initiate these processes of standardization in their own countries. So these two resources that we have include an advocacy toolkit for country level stakeholders to advocate for standards and their country's participation in ISO TC 338. And secondly, we have updated the menstrual product standard database, which was created by RHSC in 2021. Next. The intended audience for these resources are the civil society and development actors, government and policy stakeholders, industry and technical experts, but not limiting to these two stakeholders who are already engaged in some forms in the national standards making process. But we've made sure that these resources are also directed towards stakeholders like consumer experts or smaller medium manufacturers who often get left out of the process. Next. To create these resources, we conducted an in-depth review of literature. We conducted multiple rounds of interviews, many discussions with diverse and a wide range of stakeholders all across LMICs. We did this to ensure that there is a representation and we have voices from across the region. So you see on your screen, we went around with different stakeholder groups and also different processes to make this an inclusive process. Next slide. Now I'll request Tanya to take you through both of these resources briefly. Over to you, Tanya.
Thanks, Soumya. Am I audible?
Yes,
Yeah.
you are.
Okay, great, thanks. So the first resource that we've developed is the Menstrual Product Standards Advocacy Toolkit. And as the name suggests, the toolkit is designed to help stakeholders really understand why standardization is important, what could be their role in furthering this process within their countries and at ISO, and understand how they can do so, how they can further the engagement with their national standards bodies. The toolkit is intended to be not a theoretical document or a manuscript, but actually a practical pathway or a compilation of tools that people can use in a very actionable way as they go about this process. The toolkit has a very clear call to action that encourages stakeholders to engage with various types of stakeholders across industry, technical experts, government, and national standards bodies in their countries to ensure that their country is participating in ISO TC 338 and also actively contributing. The toolkit provides step-by-step advocacy strategies. These strategies span activities related to understanding the current status of the market and standards in your own country. How do you go about convening different types of stakeholders, bringing diverse voices to the table? How do you go about creating demand for standardization in the country by engaging media, by engaging CSOs, consumer interest groups, government stakeholders beyond national standards bodies who are procuring or somehow engaging with menstrual products, and also supporting national standards bodies directly to either initiate or strengthen their participation in the technical committee at ISO. The toolkit, like I mentioned before, it's not a manuscript, it's not a theoretical document, but has many tools that can help convert advocacy into practice. We've included templates for mapping the market, so that includes checklists, frameworks for understanding where the country stands, templates for making the case for standardization, tools for engaging with media, real world case studies that demonstrate how different countries and actors have gone about putting some of these advocacy strategies into practice. And the toolkit is also forward-looking in the sense that it talks about not just how do you engage with ISO TC 338, but also what to expect when the standard is developed at the global level and then has to be adopted and implemented at the country level, because that's where stakeholder engagement also becomes critical. And again, we've included real-world case studies. An example is given here on how that can happen in a coordinated fashion. How can regional coordination help across certain regions, for example, West Africa, South Asia, etc., and so on and so forth. So all in all, the advocacy toolkit is a roadmap for action. It aims to equip low and middle income country stakeholders to really engage with their governments, with their national standards bodies, to enable a standard that is representative of global voices, of diverse voices, of small and medium enterprises, of different types of experts and stakeholders working across regions and across areas of focus. And to ensure that the toolkit can be used by different stakeholders, that it will be available in 4 languages. It's been developed primarily in English, but is also being translated into French, Spanish, and Portuguese. The second resource that we've developed is, or updated for RHSC, is the Menstrual Product Standards Database. As the name suggests, it's a database of menstrual product standards globally developed by different countries, different industry associations. So anything that exists out there, we've tried to cover it. The first edition of the database, which was developed by RHSC in 2021, included single-use and multiple-use sanitary pads and LMICs and some HICs, high-income countries as well. This update will include, in addition to those products, tampons, menstrual cups, and period underwear, and also provide an update to the standards that were included previously. It's also intended to be more user-friendly so people can navigate the standards database in a comparative way. So see, where different standards compare with each other across different parameters. The fields captured in the database are both administrative and technical. So from an administrative standpoint, it covers who's created the standard, when was it created, revised, what's the product scope and category, which language is it available in, just for accessibility purposes. Many of these standards are hidden behind a paywall. They are not accessible to the public. Whether the standard is required to be enforced through a certain regulatory order, so on and so forth. And the technical information includes whether standards cover physical safety and performance parameters, and some of the examples are given here. Again, the information that we've captured in the database is many of these standards are behind paywalls, as I mentioned, by national standards bodies. And so wherever we had consent from NSBs, we have included actual data, but where not, it is in the form of whether this information is included in the standard or not. So binary yes and no, which allows for comparison across different standards. And the source information is also available, so one can go back and reach out to the NSB for further information. The website is currently under development by the RHSC team, but it will look at providing different types of comparative views, including a world or a map view, a filter view, a comparison view, and hopefully these will provide or make the database slightly more user-friendly than it was before. And this is also based on a user insights exercise that we conducted with various stakeholders to understand what do they want from the database, what do they want to see. So that's a little bit of an overview of what we have developed as these resources. We'll go in depth into what the toolkit is and what the database is, what are the methodologies, what you can expect, what the content is like during the deep dive webinar on 19th May. We'll also hear from experts from industry, from CSOs, etc., talking about how they see the utility of these resources. And also what their experiences in the standardization process have been. So please join us on 19th May to hear directly from experts and take a deep dive into these resources. So that's it from us. As far as the overview is concerned, we are happy to take any further questions. Otherwise, back to the RHSC team.
Thank you so much, Tanya and Samia. I will open it up to our audience to see if there are any questions for Samia and Tanya before we move into our second highlight presentation. So again, you're welcome to put those questions in the chat, or if you would prefer to come off of mute and ask them live, you're also welcome to do that. So yeah, any questions from the audience?
Yes, I have a question.
Yes, please go ahead.
Hi, I just want to make sure that the standards include also other devices. We are developing a new hygiene device for women, which is not a tampon, not a cup, not anything else. So I just want to make sure that we will not fall between the chairs, as we like to say.
Yeah, so
Thanks,
Tanya, do you want to?
Sure. Thanks for that question. Very valid question. And while it does not pertain to the database as such, it does pertain to the advocacy piece, because I think this is the very reason why we want as many people as possible to be part of the ISO TC338 process. So, if you are not yet engaged with your national standards body, we would encourage that you reach out to them in your country. So, you can put your point forward directly. But also, to address your concern, I'm also a member of the TC, so I can let you know that the framing of the guidelines is such that it is divided into single use, multiple use, internally used, and externally used products as of now. And so any products that fall into a combination of these categories, the standards will be designed around that. So it's not specifically to say for tampons or cups, etc., but it is eventually up to country governments to define how they adopt that standard. So again, very important you engage with your national standards body at this point already.
Yeah, thank you so much, Tanya. And maybe I'll just echo the toolkit has some really excellent messaging for how to do that engagement with country governments. So really making the case both for why standards matter, why do we need them, why should we adopt them and enforce them, importantly, as well as helping countries and different representatives engage in the process that's underway by the International Organization of Standardization, ISO. And that's the body that Tanya was just speaking about, that's actually developing what those global standards would look like. So really calling for some increased participation in that process, as well as then helping translate that to the country adoption level. So some excellent content in the toolkit to do just that. Amelia, I will hand it over to you, and then I'll take a couple questions that are coming into the chat. So over to you, Amelia.
Thanks, Sarah. Hi, everyone. Really appreciate this conversation. I just was curious about to what extent, or are you aware of what do you imagine the most significant barriers are to moving this forward? And I wondered if it's helpful for, in each country, for teams to consider applying a political economy analysis to sort of gauge a sense of those barriers. And we may already be familiar with that process or framework, but if not, I'm going to drop a link to a resource here that sort of lays out the PEA, the framework. Thanks.
Tanya, do you want to jump in on that first, and then I'll add some context too.
Sure. So very valid, Amelia. I think this would be a great supplementary resource. What we've included is in the advocacy toolkit is a market mapping and standards mapping template, which could probably cover some of this, but a detailed PEA approach could help stakeholders really understand where the countries stand in terms of how they're engaging with the national standards bodies, whether the NSB has looked at menstrual products at all, at what stage are they in the process? Have they looked at one product? Many have looked at only single-use products and not reusable products. What are the barriers to looking at other products? For example, in some countries, insertion products are not looked at because of the stigma associated with those. So all of these kinds of socio-cultural, political barriers will come to light once stakeholders start doing some of these mapping pieces. And definitely, I think this resource would be a great supplementary tool to the toolkit.
Absolutely. Thanks, Tanya. And I'll just chime in to say, and I know several people involved in the process I'm about to outline are on the call, but there was recently a PEA conducted globally looking at menstrual health kind of more broadly and really thinking about identifying some critical advocacy pathways within the context of that PEA framework. And that has resulted in a shared agenda that is under development for menstrual health in general. So not just about product standards, but thinking broadly about menstrual health. And that work is being led by a range of stakeholders that includes the Global Menstrual Collective, WaterAid, UNICEF, and many, many others. So apologies if I'm not calling out the whole list of people, but there's a number of consultations underway right now to get input on the shared agenda to make sure that it really is shared and really a community resource. So RHSC has been supporting some of those consultations. I know Days for Girls has supported others, as well as several regional bodies that have been engaged in that. So I'm happy to send you some more information on that particular piece too, Amelia. And I would welcome people who are on the line who are much more involved in that process than me to also provide added context in the chat if helpful. But an excellent question, Amelia. There's another question that came in the chat that I will elevate. So this question is from Nancy. Do country regulators require whether products meet standards to be listed on the product marketing information? So Tanya and Samia, I'll hand that to you.
So thank you, Nancy, for that question. And hi, it's so nice to see you here. Again, it's highly variable and completely depends on how the standard is enforced in the country. This is not a part of the mapping, but the database that we're putting together does include whatever information we could find on the enforcement mechanism. So, for example, if there is a regulatory order or a quality control order or reform order that specifies that the standard has to be adopted in the first place. So, first is enforcement, and then second, whether it has to be mentioned on the label. Usually, if it is enforced, the labeling requirements themselves would make sure that it's, the mark of the national standards body is put on the label. So I think the more important question here is whether the standard is voluntary or mandatorily enforced within the country. If it is enforced mandatorily, then I think what you're asking would definitely happen. But it varies. Yeah.
Yeah, thanks, Tanya. Yeah, and thank you, Nancy, for that question. I think it's a really important component of the accountability and enforcement side, as Tanya was saying. So perhaps one opportunity for us as this work moves forward and as the toolkit is out there is to really support people as they navigate that accountability angle with country governments and regulatory mechanisms. Any other questions from people before we move into our second highlight session? There's some great chat going on about the PEA and the shared agenda. So if you want to follow along there's a lot of excellent resources and contacts in the chat. But any other questions from people before we move on? All right. Thank you so much, Samia and Tanya. If people do have additional questions, feel free to drop them in the chat. There's one that just popped in, so I'm going to take it real quick because we do have time for a final question. So Adrian had asked, Tanya, you mentioned the mapping includes safety requirements and standards. Is this related to microbial count, chemical safety, or biocompatibility? And if so, how widely are these integrated in standards today? So Tanya, I'll hand that back to you before we move on.
Thank you. And Adrian, thanks for that question. We'll actually go into a deep dive of the database and some of the insights from the database in the 19th May webinar. So again, encouraging everyone to join then. But quickly to respond to your question, the safety requirements cover microbiological. So yes, microbial counts and any specific microbial requirements. So absence of, say, staph aureus or pseudomonas and other microbes. Chemical safety. So if there are any specific chemicals of concern that are being highlighted, like heavy metals, PFAS, etc. And third, yes, in some biocompatibility is included, not in many, which is a sort of a gap. And we've also heard this in a lot of discussions during the ISO TC standards development process that material safety risk assessment is an area which is a gap, but also is a gap because of lack of resources in country to actually do that testing. And so adoption and implementation also requires thinking through how those gaps can be filled. So a sort of a mixed up answer to your question, but yes, we have mapped all of these requirements and we'll be sharing a little bit more on the trends we are seeing in the 19th May webinar.
Awesome. Thank you so much, Samia. Thank you, Tanya. And thank you to our audience for the very active participation and questions. This is great. We are now ready to move to our second highlight presentation. This presentation will be on behalf of C3, the Climate Communications Collective. So I will invite our colleagues Nicole, Nomi, and Bee to take the stage and walk us through the second presentation. Over to you all.
Wonderful. Thanks, Sarah. Hello, everyone, and thank you for your time today. We'll be sharing a preview of what the June 2nd webinar will feature, specifically focusing on the intersection of menstrual health and climate change. Next slide, B. And by we, I mean Nomi Fuchs-Montgomery, Dr. B. Brown, and myself, Nicole Lower. Together, we bring over 25 years of experience from the menstrual health and climate change spaces. Next slide. And we've come together over the last year to develop 2 new tools for the space, specifically a new report that synthesizes emerging evidence about the links between menstrual health and climate change, and a database of stakeholders taking action to build more sustainable menstrual products and develop climate resilient menstrual health innovations. Next slide. Of course, we could not do this work alone. The tools were created with an extensive review of existing research and evidence around the links between climate change and menstrual health, consultations with key informants across product developers and manufacturers, NGOs, academia, multilaterals, and more actors from the space, and iterative feedback from our incredible advisory group, who are all exemplary leaders across all sectors and will be joining us during the June 2nd webinar. We aim to keep our approach for this work very simple. It's minister centered, meaning it's rights based with choice at the heart of it, our recommendations. It incorporates collective responsibility or opportunities for increasing sustainability across all stakeholders and in the product lifecycle. And we really took a systems lens to this, so highlighting policy and financing barriers, which we'll see in some of the other work. So B, over to you.
Great. Thanks, Nicole. I'm going to go ahead. So essentially, with this, in terms of where we're at in this project, so we have coming up at the beginning of June, on June 2nd, a webinar to celebrate the launch of our report. This is our Reimagining Menstrual Health for a Climate Resilient Future webinar. So go ahead and mark this on your calendar if you haven't yet. And in today's session, we're going to do a bit of a preview of what you can expect in that webinar, as well as in our report overall. And I just want to kind of emphasize that during our webinar, we are going to be bringing together guest speakers from across the private sector, policy space, and implementers. And we're really going to be having a conversational approach, so really in-depth conversations about creating change, as well as understanding what is going to be in the report and how you can use it. So today we're going to talk through some of our key findings around, first of all, why this topic area matters. Second, some of the emerging innovative solutions that are out there. And then third, some of the strategies that we recommend for building more climate resilient systems. So what we see, when we look across the menstrual product marketplace is that the space is dominated by single-use plastic-based products, which are contributing to greenhouse gas emissions. And when we look more closely at where those impacts lie, we see that there are both upstream and downstream levers for impact. So we see that the climate impacts for single-use products primarily live upstream with manufacturers and within the product design space. Climate impacts for reusable products often live downstream with users. So that's where we see things like the energy required for washing. Now, what we also see at the same time is that this is not just one directional. So this is not just about menstrual products contributing to global greenhouse gas emissions. What we also see is that climate change is shifting the context in which menstruation takes place. So we see that climate shocks, they disrupt supply chains, they interrupt access to water and sanitation. And we see also that menstruators' needs and preferences change as this context shifts. This is particularly important because we know that access to menstrual health products is critical for equity. Lack of access to these products, it increases risk of infections, it increases school absenteeism, it increases economic exclusion. Yet the reusable products are often less accessible for folks because of their higher upfront costs. And what we see as well in kind of shaping this context and shaping this conversation is that menstruation is often missing, both from the climate space as well as from health spaces. We see that menstrual health is often absent from climate policy and disaster response frameworks. And we also see that menstruation often falls through the cracks of SRHR or WASH programming. And so what we're really seeing here is a pretty important opportunity to act and take action to make this space not only more sustainable from a climate impact perspective, but also to make menstrual health and menstrual products more adaptable to changing needs in climate affected contexts. In terms of how this is framed in our report, we recognize that we need easy to understand materials that can be used for advocacy. So what we've included in our report is these tear-outs that highlight why this area matters, stories from the front lines of kind of the human impact of climate change on menstruation, as well as these comparative summaries that look at different types of products and how they are impacted by and impact climate change, really with this idea of promoting data-driven change. And we wanted to make sure that these products were going to be useful for a wide range of individuals, whether they were product designers, manufacturers, folks who are more on the policy advocacy side, or people in this program implementation space. And with that, I'm going to pass it over to Nicole. Nicole, can you tell us a little bit more about innovation and how that shows up in our report?
Thanks, Bea, of course. So in our work, we were really able to bring to life the innovation that is emerging across the full menstrual product life cycle, from materials to manufacturing and disposable. We're really seeing advancement here in materials, so looking at biodegradable fibers, design, so the self-cleaning menstrual cups for those low water environments, manufacturing from localized production to cut transport emissions, packaging and logistics, and then circularity, so compostable or reusable products. And we also realized that we need to consider a range of opportunities to generate sustainability. So rather than switching to a single best use product, looking at all of the products across what's available. So in this report, as Bea mentioned, you'll find tear-outs that help showcase products from every angle that include carbon emission impacts across the product life cycle and the areas of opportunities for innovation that are aligned to each of the products. So we'll have those in our report, but we'll also dive deeper into them during our June 2nd webinar. And with that, Nomi, over to you.
It's Nicole. We're really excited to be here. And I know that financing, policy, and advocacy are often used across all of this work in terms of levers for change. And we wanted to just call out a few specific pieces here related to our work. So first, and kind of most importantly, it's amazing that we're all gathered here and recognize that moving towards more sustainable menstrual product marketplace really requires all stakeholders to participate across the product's entire life cycle. And I think that's a theme that's coming out. And so while there's a focus on visible issues around menstrual health waste, and Bea mentioned this, particularly for multi-use products that require washing, what we see is a significant amount of menstrual health products climate contributions do occur, particularly for the single-use products, upstream. So in raw materials, sourcing, energy-intensive manufacturing, and long-distance transport. And that's why, for example, investing in local manufacturing and supply chain is an important lever for change. Just now moving to policy standards for novel menstrual products, supportive fiscal and tariff environments, we all know are really critical. It was very exciting to hear from Tanya around product transparency and standards, and great to know that the new standard database now includes cups and period underwear. And this type of product transparency is really vital for ensuring novel sustainable menstrual products are accessible to users, and that we're working towards fostering low carbon approaches among all products, particularly traditional products. And finally, when we think about levers of change for advocacy, menstruators should not bear the brunt of the climate crisis. And that's like, period, intentionally, period, that we, Bea mentioned this and Nicole talked about this, that we really are not framing the report in this work as users being responsible for the climate crisis, but really centering on rights and choice. So menstrual products must be developed in a way that's better adapted to the effects of climate change and has to be grounded in the way that users' needs and preferences change, as Bea mentioned, in the face of the climate crisis. So next slide. So when we talk about building a more sustainable menstrual menstrual health product ecosystem. As I mentioned, it really requires collective action, and we're excited for you to read the report. It will be dropping a little bit before the webinar, and creating change, as we've seen from our work in developing this, is possible. It's happening. We want to give a special shout out to our advisory group. We've had, as Nicole mentioned in the beginning, really phenomenal insights that are helping us feel confident in building a deeper understanding, and again, inspiring this confidence that change is possible. So next slide. We are very excited for the launch on June 2nd. I know we're all promoting our webinars. And as part of that, also are asking that you take a moment and register for the database. So I believe most people on this call are involved in this sector in some way or another, whether you're working on innovating manufacturing menstrual products, promoting access, research, or advocacy. This will be part of one of our products in addition to the report, this robust database, and your voice and your experience is critical to that. And I'm going to just hand it over to Bea for a big thank you and taking questions.
Thank you so much. We will, yeah, again, sorry, Bea, did you want to jump in?
No, go for it,
Okay.
Sarah.
I was going to say, happy to take questions from the audience. Same as we did before in the previous presentation, people are welcome to put questions in the chat, or if you would like to come off mute and ask your question live, we also invite you to do that.
May I? I cannot seem to find my hand raise here in this.
That's okay. Jump right in. Yeah, happy to hand it over to you. Go ahead.
Okay. So I'm developing a new menstrual device, and it's going to be disposable. However, our applicator is going to be dissolved in water, and the unit itself is going to be made from ecological materials, like it's going to be green. So, and everybody asks me, why didn't I make it reusable? Well, there were so many, because the cup is considered more green. And I wanted to ask you as the experts in this, because like cups, yes, they are reusable, but eventually you end up with a silicone, with a lot of silicone, which is not like after 5-7 years, you have to dispose of it. It can never be reshaped. It can never be used to anything else. And as you mentioned, it has also all sorts of problems of cleaning and washing. And also from the point of view of usability, it has a lot of problems. Like this is one of the reasons I believe that menstrual cup haven't gained a big market, in spite of the fact that they've been in the market more than a century. And so in my perspective, the menstrual cup is not so green for these reasons. And also when you talk about menstrual panties, so everybody say, okay, they are reusable, hence they are green, but they are totally not green. They are, you have to wash them. You have to wash them separately. After 2 years, that's it. You cannot use them anymore. So I want to hear from you. Is there a real guideline, something that I can, as a manufacturer, as a future industry, as a developer of a new hygiene device, that I've been stumbling to these questions from so many people telling me, no, you are disposable means that you are not green, but I'm using a very like completely new materials. And so I wanted to hear your opinions.
Thanks so much for this question. And I think that you raise a lot of really valuable points here, right? Like what we see across the evidence in most of these analyses of, product life cycles and environmental impacts across the product life cycle, over and over, menstrual cups come back as the lowest environmental impact, by a really significant margin. And that includes even if you only use that cup for one cycle or a few cycles, right? Those benefits are still there. But with that said, there are still certain limitations to it, right? Like you have waste with all types of products, including cups. Like that is, a reality of it. Though the volume obviously measures depending on the product choice that you make. The energy is required for washing, and it's not a product that is going to work for every menstruator in every context, right? Not everyone is going to be comfortable with it. It's not going to work for everybody's body. Not everyone is going to have access to clean water to be able to safely use that product. And so, I think one thing that was really important to us in this process was to recognize, what the evidence says about the benefits of these reusable products in terms of environmental impact, but also create space to acknowledge the limitations of them, as well as highlight ways that single-use products could be made more sustainable. And I think that what you are bringing forward here, right, is really valuable to say when you think about, okay, how can we take a single-use product and make it more sustainable? So, I think like this element, right, is really important to bring in of like, okay, we can think about the applicator and making it just dispose or something that can disintegrate. And so, I don't know that there are like very specific, there's no like criteria of like, oh, this inherently makes something sustainable, this makes something not sustainable, right? It's a very subjective space in the labeling there. I would say that one thing that is very advantageous is having concrete data about impact and having disclosure around the materials that are included, as well as the manufacturing processes. So that type of information is really valuable for us in being able to more effectively compare the products that exist. And yeah, I think like for us, it's important to really emphasize the clarity of findings, to the point of these kind of comments going on in the chat as well, right around the low impact that we see with the cup, and then also really invite folks into this process across all products and across all stages of the manufacturing process to think about ways to reduce emissions.
Yeah, thank you so much, Bea. And thanks for the question, Gila. Maybe one thread that I also just wanted to pick up that Bea just spoke to too is the importance of choice and recognizing that within the conversation on climate change, a lot of people who menstruate are very keen to use products that are more eco-friendly, but there's not a single product that is going to work for everybody, right? People have different preferences, they have different needs. Sometimes those needs are paired with different contraceptives that then have impact on, how they choose to manage menstruation. And so one thing that I think the C3 team has done an excellent job of in this scope is thinking about that and how do we frame this issue around choice and recognizing that there is no ideal product, but what we do need to do is create an enabling environment and a space where there's more innovation for better, more eco-friendly, more sustainable products so that each person then has a broader range of choice to choose from. And one thing that Adrian just put in the chat that I also think is well captured in the resources that the team is about to publish ahead of the June webinar, is this look at the life cycle of the product so that it's not just, which one's more eco-friendly from a disposal perspective, or which one's more eco-friendly from a waste volume perspective, but really zooming out and looking at that full picture of everything from manufacturing to shipping to the materials that are used to then also the disposal side. And I think the way that they've framed a lot of that really speaks to what you're elevating here as well, Gila. So an excellent question and an excellent response from the team.
Sarah, I just was going to jump in really quickly. One, to congratulate you, Kayla, because as we're all saying, right, that this is really grounded in user choice and preference. And just like contraceptives, and Sarah, thank you for underlining this. There's not a one size fits all. There's not a magic bullet. we all have different bodies and different needs. And so I do want to just pause and recognize like the amazing work that you're doing. We need innovation in this space, and congratulations for taking a really bold step to do that. It's phenomenal. And second to Adrian on appreciate your comment. And as Sarah mentioned, and both Nicole and B had discussed, these tear outs are exactly that. And so I think it both highlights the importance of not just looking at one indicator around like making a decision, but a number of different factors. And then the report also calls for this important need for more data and evidence. And that's collectively on all of us in our broader community in terms of the advocacy, and be just underscore this. Like without the data, it becomes quite flat in terms of being able to advocate for what's needed. So there's both like the importance of the transparency and visibility on the tear outs, but also collectively how we can collect and pursue a deeper evidence base. Thanks, Sarah.
Absolutely. Yeah, thank you. And excellent question, Hila, as well. And much more to come in the June webinar and in the materials that we're about to publish. All right, I think in the interest of time, I'm going to move us on to our next presentation. If there are other questions, comments, reactions, please do put them in the chat. We will have some time at the end to come back to those. So thank you to the C3 team. And I am now excited to welcome Chris and Rita from Man Global Health. Chris and Rita are going to present on the affordability question and what's really driving the cost of menstrual products. So Chris and Rita, over to you.
Thanks, Sarah. And how cool to see this work come together in the context of all these other initiatives that are happening. Okay, are we looking at my screen?
We are, and it looks great.
Okay, great. So on to perhaps the most sizzling topic, which is how we can navigate tax reform to improve product affordability and access, the very best for last. But it actually, tax policy is something that a number of countries have deployed to support affordability for menstruators throughout the world. And in partnership with RHSC, Man Global Health aimed to focused on understanding what happens when countries implement a favorable tax policy, like an elimination of VAT or custom duties, which is a lever that has been deployed again in a number of countries to varying levels of success. So our focus was really to understand how those shifts in tax policy show up to the prices that consumers pay for menstrual health products. The work also looks forward, helping us to understand how new policies or policy tweaks can impact pricing, which is where the menstrual health product policy simulation tool comes in. The Excel-based policy simulation tool models how costs actually move through the system and estimates how policy changes impact consumers. A full report outlines in detail the concepts and findings that is supported by a published lit review and a methodology document for those that want to really dive in and apply the model in a specific market. But for now, we're just going to focus on an overview of concepts and key learnings. And my colleague Rita is going to share how this plays out in Kenya to really provide a bit of flavor to an otherwise fairly dry topic. So the model explores the potential impact on consumer prices of changes in tax policy, but we also looked at other costs such as import duties or para-tariffs and other regulatory fees that governments might impose on menstrual health products. Our work also applied the lens of affordability and equity, including the ability to pull out the impact of price changes for lower income menstruators, so we can really understand how prices changes impact different income groups, not just average effects across the entire population. And finally, it also allows users to compare the estimated benefit to consumers against fiscal cost to the government, which is often central to government decision-making. And a big caveat, these are modeled scenarios, so they're directional and they are estimates. And I keep using the term estimates because markets are very messy with imperfect information, and so it's impossible to predict perfectly. So first, a few concepts that are important to understanding how tax reform impacts prices. This graphic here that we're looking at introduces the value chain and outlines how costs build at each stage of production of menstrual health products, importation, distribution, and onto the shops involved in getting a product into the hands of a menstruator. As Rita will share, the value chain looks quite different in key ways for local importers than it does for domestic manufacturers. Pass-through is an important concept, and it's just a share of any savings that results in a tax reduction that reaches consumers. We know that not all cost savings from policy changes that impact upstream importers or manufacturers actually reaches a consumer in the form of a reduced price. And so when we talk about pass-through, it's what the cost savings are to the actual buyer of the product. So our work found that pass-through is impacted by a number of elements. First, a number of factors on the left we've bucketed into market structure, which includes how competitive the market is and the role the informal markets play in getting products to consumers. Informal markets are important. They play a huge role in low and middle income countries. They are fragmented and less efficient at distributing products. So think of open air wholesalers and wholesalers that sell to unregistered shops in small towns and rural villages throughout Africa and Asia. Compare that to formal markets, which consist of larger supermarket chains with sophisticated centralized distribution, which are much more likely to report to government around taxes or other data. So Rita's going to talk through administration efficiency in a bit more detail, or how a government revenue system is managed to collect taxes and reimbursements, but it plays a big role in how pass-through is made through to menstruators. And finally, we've heard a lot about HS coding, and this is also a theme that plays largely here. HS coding plays just a huge role in how products and raw materials are classified at the country level and treated by government systems during importation and domestic manufacturing. And HS codes determines whether and how a menstrual health product really qualifies for a favorable tax policy. And again, more detail on that a bit later. So value-added tax is actually quite simple and super duper complicated once we get into the details. So we're going to focus on the simple for now. Read the report or tune in for our follow-on webinar for more of the complicated. But VAT is just a tax applied at each stage where value is added in the manufacturing, importation, and sale of a product. Businesses pay input VAT on what they purchase, and when they sell the product, they charge VAT, which is the output VAT. This repeats at every stage of the value chain as it reaches the consumer. So businesses pay to the government the difference of what they paid in input versus output VAT. And on the bottom of the slide, it's really important to note VAT can be structured or rated in different ways. So there are standard ratings, exemption, and zero rating are the most common ways of rating. And each have a big impact on different actors in the value chain, like importers versus manufacturers, and of course to the end consumer. So on to the learnings of our work. So tax reform is, and it's really important to highlight this, it is absolutely valuable. It lowers production costs, importation, and distribution costs. And it has a secondary benefit of getting governments and people focused on menstrual health and gender-specific issues. So favorable tax policy is a good thing. And a big but is not all policy translates to cost reductions reaching consumers. And some policies have uneven impact on different players, which again, Rita is going to talk about it a bit more. In practice, our modeling, which is supported by the literature, suggests that only about half of savings translate into lower prices for the consumer. This means even after reform, affordability gaps for low-income users persist. So what's happening? First, as I just noted, we estimate pass-through of savings from favorable tax policy is incomplete. Market structure plays a big role in that. When competition is limited or markets are highly concentrated, firms are more likely to retain cost savings rather than pass them on, retain them in the form of profits. Informal markets, which often serve lower income consumers, are also less likely to fully transmit tax savings to consumers for a variety of reasons. And again, tune on to the webinar for more of that. And where there are administrative or compliance constraints, even well-designed policy changes may not be fully implemented or enforced for all users. Finally, and most perhaps importantly, VAT design matters a lot and policy design matters a lot. So this is where positive policy intent can inadvertently or unexpectedly have adverse impact on some actors, often disadvantaging in particular domestic manufacturers or product innovators and smaller companies with fewer administrative resources. So now some broad considerations and recommendations before we get into the details in Kenya. First, it's important to align tax design to influence the market serving users. So design for a market driven by domestic manufacturing like India, which is another country that we highlighted and which we'll go into more detail in our webinar, will look a lot different than a mixed import and manufacturing market like Kenya. Second, it's important to aim for design that is tax neutral. That is, again, reinforcing the bullet point made above, that is one that importers, manufacturers, small enterprises, and innovators can all benefit from and which they can actually navigate. Third, policy should factor in the ability of the revenue authority to act on it, that is factoring in the realities of how countries manage compliance with their tax system. And harmonizing HS codes will reduce the chances products are inadvertently left off of tax design and benefit from that. So these new and innovative products that we've been hearing a lot in this webinar, making sure that those new products also have the chance to benefit as it comes online. It's important to communicate changes in policy, not just to actors through the value chain, but also to consumers to create advocates at that level. And finally, recognizing market shaping initiatives are still required to address a multitude of market failures, and it's important to design targeted distribution of subsidized products to priority populations, including lowest income populations. So tax reform is not enough. We need to make sure that lowest income people, our data shows, still cannot afford even partial use of products. We've got a number of advocacy messages and recommendations that we will share at the webinar, but I'm going to hand it over to Rita to walk through some of the specifics of how this plays out in the Kenya market. So Rita, over to you.
Thanks, Chris. Please confirm that you can hear me.
We got you.
All right, great. Let's go to the next slide, please. So I think I'll bring to life some of the dynamics that Chris has spoken through using the Kenya case study. And I think a good place for us to start is to understand that Kenya has had very progressive tax laws over the years in an effort to bring menstrual hygiene products into a place where they're affordable and accessible for those who need them. So in the earlier years, we saw VAT exemptions and 0% duty on finished imported products. But progressively, we've seen that exemptions being extended to raw materials with an expectation to open up local manufacturing. And then more recently, we are seeing a lot of program reforms, like the free pad distribution program in schools. So I think with all these reforms, the question that lingers in most people's minds is this translating into affordable prices at the retail shelf? But unfortunately, where we stand at right now, still there's an affordability gap in Kenya. There's still an affordability gap in Kenya. And the reason why there's that affordability gap is because of something that Chris had touched on, which we are calling the stack VAT. And the stack VAT really speaks to the pathway in which products and raw materials come into Kenya. On the left, you will see where we are at in terms of imports, and it's a very clear pathway. So we are moving in from goods coming in at the port of entry and going down just one level down to distribution and getting to the consumer. No VAT is charged and no costs are embedded. But it's a very different story when it comes to domestic manufacturers, where the process is lengthier. So we have raw materials coming in, and it's important to note that 80% of raw materials that are used for production in Kenya are actually imported into the country. And even though the statement is that they come in VAT exempt, there are some that are still taxed, and such as packaging material. And what we got from industry people is that the packaging material can account to up to 30% of the market of the cost of the product. So that VAT, because it's not claimable because the end product is VAT exempt, what means that is levied on the consumer. And then down the supply chain, you will see that there are other areas where VAT is stuck into the system, and which is not, we are not able to claim. And if we are not able to claim, then that goes into the embedded cost. So I think what is important to note is that this tax regime, or this tax design of VAT exemption was not designed to disadvantage the local manufacturer. At the time when the tax came into play, Kenya was a very VAT dominant, import dominant market, but with time we've progressively seen local manufacturing is coming on board. Currently we have 6 local manufacturers on board that are providing a lot of close to half of the required pads into the country. So I think what we need to think through as we go through the conversations on tax is how we level the playing ground. Next slide. So over and above VAT exemptions, we also try to look at whether there could be any other structural barriers that could be contributing to policy intent not translating into affordable prices. And what we found is, yes, there are other structural barriers, and those we categorized under 3 key areas. So there's policy design, there's market structure, and there's implementation friction. I think what's important for me to note under policy design over and above VAT exemptions is something that we call duty remission. And duty remission mainly is when we say that goods are coming in, raw materials are coming in import free, it's not an automatic exemption. And what happens is that local manufacturers have to go through a process where they apply for remissions for them to be able to unlock those tax benefits. And this is because raw materials that are used to produce menstrual hygiene products are also used to produce other products. So a manufacturer has to be able to prove that the goods that are coming in are going to be for the purposes of manufacturing menstrual hygiene products. So I think what we need to understand is that the duty remission process is a very tedious process. It's lengthy, it's cost intensive, and for smaller manufacturers, they are not able to go through the process. And not complete duty remission is offered on all products because it's quota based. And if your quota is not met from what you had applied for, then you would have to pay tax at the point of entry, which again becomes a stack cost that has got to be passed on to the consumer. So across board, what we are finding is that cost savings, by the time they get to the consumer, they have been diluted across the value chain. Next slide, please. We took Kenya's scenario and modeled it through the tool. And what we found, what we did is that we shifted VAT from standard, which is 16%, and we went into exemptions. And we assumed that there was exemptions of from 16% VAT, and we exempted the VAT, and then we assumed that we had eliminated all import tax duties, and we had lowered the para tariffs. And we looked at what the results were across 3 key areas. One was under the price impact, and under the price impact, what we saw after modeling from the results is that yes, indeed there was a price reduction. And even though there was a price reduction, only 60%, 50 to 60% of the savings passed through to the consumer. Of course, the formal markets had more pass-through as compared to the informal markets. So yes, there was partial reduction, but it was uneven based on the market where the consumer was accessing the goods. Then looking at the results, at the same modeled results through the market impact lens, what we saw is that VAT exemptions, though very well intended, had created some distortions in the market. And the reason is that VAT is stuck; it cannot be claimed. So there's an uneven playing field for local manufacturers, which disadvantages them. and makes them unable to compete competitively with their importing counterparts. And what we are proposing around this particular piece of market impact is if we could be able to turn Kenya from exemptions to zero rating for us to be able to correct for some of these distortions and make local manufacturers more competitive. And finally, under the affordability piece, what we are seeing under the affordability piece is that even though there was a price reduction across board after the taxes were reduced, we still have the product remaining unaffordable for the low-income groups, and that is resulting in some equity gaps. And for us to be able to bridge those equity gaps, what we are proposing is that maybe industry players can look at targeted subsidies and build those into programming, but also look at other social protection mechanisms that can come into play for us to be able to bridge that affordability gap. Next slide, please. And then I think once we have looked in at the challenges, the next question then becomes what next? What next, or what changes from here? And what we agree for Kenya is that the policy is already in place and it's grounded. What we need to be looking at is how we can unlock the affordability gains by correcting for the inefficiencies that currently exist in the market. We looked at two key areas that can be able to give us very quick wins. One is the policy design. And under the policy design, we looked at zero rating as opposed to exemption, so as to be able to recover VAT. But we also looked at the issue of streamlining duty remission so that we can be able to bring in smaller SME manufacturers into this bracket for them to be able to also competitively apply for remission and be able to bring down their cost and open up the market and bring up affordability. And the implementation frictions, what we were seeing is that there was some frictions around classification of MH products. For example, menstrual cups in Kenya are classified as beauty products, and they attract both import duty and they do attract VAT as well. So correcting for some of these misclassifications will also go a very big way in terms of unlocking the affordability gaps. And then, of course, simplifying the administrative processes, and especially around VAT refunds, which is very slow and it holds on to cash flow when it does happen. But currently, what is happening is that the government has introduced what they are calling a credit system. So no money really is leaving the system, and what manufacturers are doing is offsetting any tax they owe to the government against any credit that they have accrued over time. But if this can be streamlined so that this cash can be unlocked and made available to the business, some of these areas we can see that they can begin to correct for the affordability gaps that do exist. So for Kenya, where we are ending and what we are saying is that the opportunity the opportunity for us right now is not having new policies. What we require at the moment is making the existing policy work. Thank you.
Thank you so much, Chris and Rita. We can now take a couple of questions from the audience. So same deal as before. If you have any questions for Chris and Rita on the work that they've been doing related to tax reform, feel free to put your questions in the chat, or you can raise your hand and come off mute. Yeah, Martin, over to you.
So that's great, Chris and Rita. Thanks so much. So, we often hear a lot about political will behind tax reform and menstrual health products. One thinks about several first ladies in the West African region who've put their substantial weight and thinking behind bringing this tax reform about. But it's incredibly complicated, multifaceted, as yourself and Rita have set out so clearly. So what role that kind of that high level political commitment and how to then make sure that that flows through into the sort of reform we need to see in order to really get products both affordable and accessible.
Yeah, that's a great question, Martin. I'll take a stab first. I think Kenya is a great illustrative example of there was the will and a movement to enact some of these reforms, but without ensuring that there was thoughtful design behind the reform, that there was inadvertent consequences rocketing through the system or
Mm,
flowing through the system.
mm,
So we
mm,
see in Kenya, there was a phased approach where they first eliminated VAT, then they adjusted the taxation on imports, and then there was a recognition that domestic manufacturers needed to benefit through an exemption on raw materials, and then finally in another adjustment. But that was over the course of a decade. If there had been perhaps some thoughtful tax advisors working with the advocates up front, we could have gotten the tax reform nailed down front. And even now we're seeing after a series of changes, domestic manufacturers are quite vocal in their desire to see further reform. And so just matching advocacy and will with the tax accountants to really help think through what some of these implications are and how small players in particular, or innovators, cottage manufacturers can benefit from tax policy just as large multinationals like P&G.
Thanks so much, Chris.
Thanks, Chris. Thanks, Martin. Any other
Martin,
questions?
so maybe I can reply really briefly to Martin's comment because I think
Yeah,
it is
go
a
ahead.
really, really important piece. So the end of all of this work is not the report and it's not the tool, and it is really that engagement. And I think that for the longest time, when we've been looking at menstrual health interventions, the ministries that have been approached are the ministries that suffer the consequences of poor menstrual health, right? Education, health, gender, youth, adolescent. But the conversation needs to be taken to the ministries of industry, trade, and investment. That's something that we as SHF do in Kenya specifically, and people like Rita have been very kind to sit in conversations between the ministry and the Kenya Association of Manufacturers to maybe undo some of the damage that has been done in some of the reforms and better design all of this. But yeah, it really requires that we anyone who advocates for menstrual health really needs to up their business skills, really understand these tools, understand these taxes, and be able to have a technical conversation with institutions or government officials who are technically responsible for this. And that's not something that SHF can replicate on its own. We'll really require everyone in that. But I think that the fantastic thing about this piece of work is that that tool now exists. There is now an opportunity to learn, to upskill, to apply this methodology to another country and become that informed stakeholder sitting at the table and providing that nuanced guidance. So yeah, big thank you to the team for setting this up.
Yeah, thank you, Adrian. And you set me up very nicely for the closing remarks that I want to make. Although I'll ask that you not go far because I'm going to pull you into some closing remarks as well. But I think, one thing that really underscores all of this work, and Adrian, you said it so perfectly just now, is the importance of collective action. I think each of these different scopes really, really illustrate the need to move beyond kind of our normal engagements with people that we see on the day to day and to really expand that out to engage multiple stakeholders from different sectors and from different ministries or departments that we don't always work with. The menstrual health supplies workstream, as Diana said at the beginning, had highlighted a couple of different pathways that they thought would be really the most effective to develop equitable markets for menstrual health supplies. And these three came to the top. The importance of really looking at standards and the critical role that standards play, not just in assuring safety and quality for the end user, but also as a critical market pathway and getting new products into markets. The importance of looking at climate change and the way that that intersects with markets, the way it disrupts access to the end user, the call for innovation and just better support for a broader set of choice in products that people have access to. And then also looking at affordability and really trying to overcome the challenges to affordability, recognizing that in most markets, menstrual products are things that the end user is purchasing. And so how can we do that in a way that is sustainable and that creates access to products long term, but that is also equitable? Another theme that rose to the top that we've also received support for is related to HS codes. And so I think many of you in the work stream have already heard about this work a bit, but SHF is doing some exciting work to propel that forward, along with RHSC and several other partners in our ecosystem. And interestingly, these three different scopes of work, which might seem a little bit different in many ways, have two things in common. One, I think, has become clear in this webinar. They are really critical to promoting equitable market development. The second is that they all actually highlighted HS codes as a potential barrier and opportunity for collective action. And so, Adrian, I'm going to invite you to come on for about a minute to give us an update on the HS codes, and to just share with the group we have on the line sort of what comes next with the HS codes work. So, Adrian, I will hand it back over to you for a moment.
Thank you very much, Sarah. I'll try to stick within the minute. So in a nutshell, it's 3 years ago in Accra at the RHSC, last RHSC annual meeting, that we started the work on HS codes. And I do want to mention that because it's the power of convening that labeled this little seed to grow. Fast forward to today, the last 12 months, we've been working closely with bilateral trade missions, the World Trade Organization, the World Customs Organization, to look at, is it possible to revisit and change the international HS codes for menstrual products. On March 16th, the 166 members of the WTO unanimously approved a policy guidance to the World Customs Organization to revisit. So that actually means that there is now the demand from governments to look at changing this. As part of these conversations, it was agreed that SHF, as a multilateral and neutral international UN body, will be submitting on May 25th the official request for revision of menstrual products, taking into consideration the categories that are currently being reviewed by ISO. So this will cover nearly the majority of products that are on the market today. And while we've been working very hard with different experts to design this draft proposal, we will be inviting people next week, and I believe I put in the email the 12th of May at 2 p.m. CEST, different stakeholders from, among others, the RHSC, MH Supplies workstream, and other different work streams for an information and consultation session. So we can give you more information about what this new structure might look like, how the HS revision process over the next couple of years is going to look like, and giving you an opportunity not only to ask questions, but also to share reflections and inputs so that we can still take that into consideration before the proposal moves to the WCO. I'll stop there.
Beautiful. Exactly a minute. Thank you, Adrian. So yes, we will circulate the call and information for that meeting through the work stream. So stay tuned on that front, but very exciting to see this piece moving forward as well. This brings us to time on this first webinar. So we just wanted to pop up the next three. If you registered for the series, you should already have these in your calendar. If you didn't, I just put that link in the chat, and we will continue to promote the series through the menstrual health supplies work stream. The next webinar on the 19th of May will focus on product standards, followed by our climate change webinar on the 2nd of June, and then ending with the webinar on affordability and tax reform on the 16th of June. And just so everybody has the information about when you can expect these resources that we just walked through today, we plan to publish them about 1 to 2 weeks in advance of the deep dive webinar. So you will get the advocacy toolkit for menstrual product standards later this week, as long as you are subscribed to the webinar series or to RHSC's menstrual health supplies workstream. And then following that, we will release the climate resources and then the affordability resources. I want to say thank you so much to all of our excellent speakers, the different presenters, as well as the teams that supported this work from behind the scenes. I want to thank Tanya and Diana, our menstrual health supplies workstream co-chairs, who really helped to make this possible by leading the group where we came up with these ideas and really looked at the opportunity for collective action. I want to thank the RHSC team who supported this work from behind the scenes today, and who have been hard at work in developing the web pages and relevant materials to release these tools. And I also wanted to thank the UN Sanitation and Hygiene Fund for their support of these resources. We are very excited to get these into the hands of all of you on the line, as well as the broader menstrual health supplies ecosystem, and know that we will be able to make an impact because together we are stronger. So thank you all so much. We look forward to seeing you in 2 weeks, and I hope you have a great rest of the day. Bye, everybody.